Doctors are urging people to seek medical advice whenever abnormal symptoms arise. This after the recent death of well-known local marathoner Eugene Lim from stage 4 cancer in his bladder. For him, signs of abnormal discharge came 6 years prior, but checks did not bring up a cancer diagnosis. Mohammed Bahajjaj takes a look at some of the grey areas in cancer screenings and why some dangers go undetected until it's too late.
In 2020, Eugene Lim, an avid runner, discovered brown urine after one of his runs. Initial checks didn't show anything concerning. However, 2 years later, the brown urine got more frequent. In June 2024, his urine turned deep red. Further tests confirmed a stage 4 bladder cancer called urothelial cancer. The cancer had spread to other parts of his body, including his lungs and neck. After battling with the illness, the 45-year-old died in 2026. According to some cancer specialists, his case was unusual.
So the median age of people with urothelial cancers is 60 and above, right? And this gentleman was in his 40s. So it is uncommon to have urothelial cancer at that age. Hence, the degree of suspicion, even by family medicine specialists and doctors, may be low for urothelial cancer. And usually we would treat for common things like infection that can also cause urinary issues.
Professor Ravindran adds that there are currently no screening tests for urothelial cancer globally, making it especially difficult to detect. Other hard-to-spot cancers include pancreatic, liver, bladder and ovarian cancer, among others. Recent studies show that 7 in 10 cancer deaths come from cancers without a recommended screening test. For example, kidney cancer. Around 6 in 10 cases were identified incidentally from scans. One doctor I spoke to said that contributing factors to bladder cancers like urothelial cancer include things like obesity, habits like smoking, and the environment, which is why it's important to lead a balanced and healthy lifestyle. Still, it begs the question, how is it that someone who is as young, healthy, and a marathoner like Eugene Lim could contract such an illness?
The research suggests that earlier onset cancers tend to be sporadic, meaning that they happen based on maybe some cancer mutations. They are not predictable, they are sporadic. Generally, it just means that you are very unlucky in that the cancer gene mutates and then the body loses its ability to regulate this cell division. So the abnormal cells multiply, and then they end up being a visible tumor, for example, in a certain part of the body.
At the moment, one can only wait for new medical research to catch up. In the meantime, paying attention to symptoms is crucial. One doctor at the National University Cancer Institute Singapore says that a telltale sign for urothelial cancer is blood in the urine, even if it's just a bit.
Cancer cells are metabolically active and consume energy as they grow and multiply, so this can often show up as chronic fatigue, unintentional loss of weight and appetite. But this can sometimes be very non-specific, so it's crucial that one understands his or her own body well, such that if there are any new symptoms, and especially if they persist over a period of time, to always seek medical help.
Dr. Tan adds that while all cancer screening tests are not perfect in avoiding false indications, he strongly advocates people to go for checks when necessary. This allows early detection and is proven to result in better survival outcomes with treatment, by as much as 90% for some cancers.
Still on cancer screenings, hospitals in Singapore are seeing up to a 40% increase in checkups over the past year amid more awareness for early intervention. Still, doctors are warning against over-testing and using unproven testing methods that could lead to unnecessary costs and may even worsen your health. Mohammed Bahajjaj once more.
Over the past year, Tan Tock Seng Hospital saw a rough 40% rise in people going for cancer checkups. The screenings are mainly for colorectal, breast and cervical cancer, the more common types of cancer in Singapore. Doctors say the increasing awareness of early interventions is due to national initiatives like Healthier SG and social media. As more people go for screening, doctors are urging them to be cautious when looking for answers.
And I think in the same vein, everybody starts to look up on the internet or like ask around or what tests should they do, even if they are asymptomatic. They feel healthy, they don't have any problems or health problems at this time. So they just want to, get a clean bill of health per se. And this leads to more tests. Healthcare resources is finite, right? So we want to avoid overdiagnosis or over-treatment, but we also want to avoid missing early treatable conditions that can affect someone's lifespan, such as cancer. So I think there's an intricate balance.
Over at the National University Cancer Institute Singapore, it's seen roughly 20% more people going for cancer screenings after the COVID-19 pandemic. It calls for more public education to prevent over-testing.
The more tests you do, the more you incur unnecessary healthcare costs. And one of the downsides is also that a lot of these tests can result in high false positive rates, meaning that you have a scan that shows something, but you're not actually suffering from cancer. And these can actually be quite debilitating to patients because it causes them to be very anxious and they might not be able to lead their lives properly after that.
A similar sentiment from the National Cancer Centre of Singapore. There's been around 35% more cancer diagnosis in 2019 to 2023 compared to the same period 15 years ago. While it acknowledges that early testing is good, it warns against new and unproven screening methods.
And if we simply, go around screening and doing tests that are unproven out there that are sold commercially by many companies saying they can do blood tests, they can pick up cancer and so on, then without the data to support the use of these tests, what's going to happen is a lot of times we will just end up with a very anxious population because some of these tests have not been validated or proven in a large population setting to reduce the risk of late-stage cancers.
In the meantime, NCCS is doing its own clinical trials of new cancer detection methods before deciding if they can be rolled out. Professor Ravindran is suggesting following evidence-based methods such as the Health Ministry's recommended cancer screening programs for various age groups and genders.